Hello guys, good morning to all my third year students. So for our first lecture, since we're done or you are done viewing the anatomy and the physiology of the heart, now we're going to talk about the diagnostic evaluation of the heart. So there are several diagnostic procedures that are done to assess the heart, and we're going to talk about them here and what our nursing responsibilities are going to be. So we have laboratory tests that we are going to discuss here: the cardiac biomarker analysis, lipid profile, cholesterol levels, triglycerides, the brain B-type natriuretic peptide, the C-reactive protein, and homocysteine. Let's start out first with the cardiac biomarker analysis. This is used for the diagnosis of MI or myocardial infarction. And when myocardial cells become necrotic from prolonged ischemia or trauma, they release specific enzymes. So, for example, a patient is having a heart attack. And as we all well know, in heart attack, the blood or the coronary arteries that are supplying the heart with oxygen-rich blood is going to be blocked by an embolus, for example. Now, once that specific side of the heart becomes ischemic, so there's limited blood supply or no blood supply at all because of that blockage, it will now lead to necrosis, which will release these enzymes such as creatine kinase or CK isoenzymes, CKMB, and proteins such as myoglobin, troponin T, and troponin 1. So they need to assess for these things. If the patient has had a heart attack or myocardial infarction. Next would be the lipid profile. Here, the things that are measured would be the cholesterol, triglycerides, and lipoproteins. They are used to evaluate a person's risk of developing a coronary artery disease. So when we talk about coronary artery disease, this is somehow one example would be atherosclerosis, where there are plaques inside the patient's coronary artery. There are plaque buildups. We'll talk about that later once we go to that topic, CAD. So here, although cholesterol levels remain relatively constant over 24 hours, the blood specimen that is obtained from the patient for the lipid profile should be obtained after a 12-hour fast. So we are going to tell the patient to fast for 12 hours first before a blood specimen is going to be withdrawn from them. And we have the normal levels here for the total blood cholesterol. Desirable, it should be less than 200 milligrams per deciliter. While if you are borderline high, you will have a blood cholesterol of 200 to 239 milligrams per deciliter. If it's over 240 milligrams per deciliter, then you have a high total blood cholesterol. Now let's go to low density lipoprotein. This is the bad cholesterol. Remember during your nutrition when we talk about LDLs, low, hell, bad, high, heaven, good. So we'll talk about low density lipoprotein here. The optimal level should be less than 100 milligrams per deciliter. Near optimal, it should be in this range, 100 to 129 milligrams per deciliter. For borderline high, it's 130 to 159 milligrams per deciliter. And for high levels of LDLs, it's in the range of 160 to 189 milligrams per deciliter. So that is for lipid profile. For high density lipoprotein, the good cholesterol, the optimum level should be 60 or more milligrams per deciliter. And if you have a high density lipoprotein of below 40 milligrams per deciliter, that means you are at risk for the development of a heart disease, for CAD. So it shouldn't be below 40. For triglycerides, the normal level should be less than 150 milligrams per deciliter. Borderline high is 160 to 199 milligrams per deciliter. Well, for high, it's 200 to 399 milligrams per deciliter. Very high would be 500 milligrams per deciliter. So we should keep our triglyceride levels less than 150 milligrams per deciliter for us to have a healthy heart, healthy coronary arteries. Now for homocysteine, this is an amino acid that is linked to the development of atherosclerosis, because this amino acid, this can damage the endothelial lining of the arteries. So that's the innermost layer of the artery. And if this one is high, it can damage it and it will promote thrombus formation. Anything that damages the inner lining of the artery, the immediate response of the blood there is to control the damage by doing or by creating blood clots through thrombus formation. And if that happens, that is dangerous, most especially for coronary arteries, because these blood clots can block the smaller portions of the coronary arteries, leading later on to myocardial infarction. So elevated blood levels of homocysteine is thought to indicate a high risk of CAD, even stroke. It's the brain counterpart of heart attack. We rarely call it a brain attack, and it's commonly called a stroke, or in medical terms, it's known as a cerebrovascular accident. And also the development of peripheral vascular disease. A 12-hour fast is necessary before drawing blood samples from the patient for accurate serum management. So, like the nursing responsibility for the lipid profile, we need to advise the patient to not to take in food for 12 hours prior to drawing blood from the patient. The results, optimal levels would be less than 12 micromoles per liter. Borderline is 12 to 15 micromoles per liter, while high risk is greater than 15 micromoles per liter. Now we go to this, the electrocardiography, ECG or EKG. This is a graphic representation of the electrical currents of the heart. And our nursing responsibility here is by placing electrodes on or in a standard position on the skin of our patient's chest wall or extremities. But this is most commonly done on our patient's chest wall. The standard 12-lead ECG is used to diagnose dysrhythmias, conduction abnormalities, and chamber enlargement, as well as myocardial ischemia, injury, and infarction. And it can also suggest cardiac effects of electrolyte imbalance, such as high and low calcium and potassium levels. So the components of the ECG and their intervals are the following. You have the P wave here, this one. If you can see the illustration, this is a record of the electrical activity through the upper heart chamber. So here, the electrical activity of the atria. While the QRS complex, the next portion of the ECG, is a record of the movement of electrical impulses through the lower heart chambers, through the ventricles. So it's the movement of, let's call it electrical impulses or electricity or nervous impulses to the lower heart chambers, which are the ventricles that we have here. So that is the QRS complex. While the ST segment, this straight line here before the T wave, shows when the ventricle is contracting, but no electricity is flowing through it. So the ST segment usually appears as a straight level line between the QRS complex and the T wave. While the T wave shows when the lower heart chambers are resetting electrically and preparing for their next muscle contraction. So there. That is the ECG components and intervals. The P wave is more of the atrium, activity within the atrium. The QRS complex is the activity within the ventricles. And the SC segment, the ventricle is already contracting at that time, but no electricity is flowing through it. While the T wave, there is a resetting of electrical impulses in the lower chambers, in the ventricles, in order to prepare itself for another muscle contraction. Now, as you can see here, this is the proper ECG lead placement. So you should learn how to do this, most perhaps in your RLE subject, on how to place correctly the electrodes for the ECG. Now, our nursing interventions or responsibilities for inpatient cardiac monitoring. In order to minimize false alarms, proper skin prep must be done before applying the electrodes. And it should be changed every 24 hours. Also check for any allergic responses to the adhesives and the electrode gel, if the patient has any of those. Proper positioning of the electrodes should be done as well to avoid the occurrence of artifact. When we talk about artifact in ECG, this is the abnormal ECG pattern caused by muscular activity, patient movement, electrical interference, or lead cable or electrode malfunction. Meaning there is a false alarm or false positive appearing on the patient's cardiac monitor because of artifact. Maybe the electrodes were improperly placed. Maybe the patient is moving a lot, and artifact can mimic dysrhythmias and can cause false alarms. Our nursing responsibility here is to properly position, properly place the electrodes according to that illustration, this illustration that I have shown you, in order to avoid the occurrence of artifact. And it is our role to respond to and correct all monitor alarms immediately. We also need to keep the equipment clean to prevent hospital-acquired infections, especially nowadays. Next, we have the cardiac stress testing. There are two types, the exercise stress test and the pharmacologic stress test. The stress test helps determine the following. 1. The presence of a coronary artery disease. 2. The cause of chest pain. If the patient is experiencing chest pain, most especially if it's a left-sided chest pain. The functional capacity of the heart after myocardial infarction or after heart surgery. The effectiveness of anti-anginal or antiarrhythmic medications. We'll talk more of that later on. And the occurrence of dysrhythmias, if there are any present on the patient's ECG. And specific goals for a physical fitness program. So if the patient is athletic or something, they need to test this, or they need to do tests such as this in order to detect if the patient can handle rigorous physical activity. Now, contraindications to cardiac stress testing. If the patient has had an acute myocardial infarction within the last 48 hours. So, of course, the patient cannot handle cardiac stress testing if the patient has had an MI. Unstable angina pectoris. So if the patient has this type of angina pectoris, the patient or the pain, chest pain that the patient feels is unpredictable. We'll talk more about the types of angina pectoris once we go to that topic. This type, unstable, is where the chest pain is unpredictable. The patient doesn't know when it will come. Or if there are any uncontrolled dysrhythmias with hemodynamic compromise. So doctors need to check this as well through ECG. Or if there is severe aortic stenosis. So there's a narrowing in the patient's aorta. This one is contraindicated. Or if the patient has infection of the inner linings of the heart, such as acute myocarditis or pericarditis. And if there is a decompressed heart failure. So if heart failure is present, the patient is not allowed to take a cardiac stress testing. So in the exercise stress test, what the patient does here is that the patient walks on a treadmill or pedals on a stationary bicycle. And during the test, the following are monitored. 2 or more ECG leads for heart rate, rhythm, and ischemic changes. As you can see in the example here, it's a comedic example, by the way. There are ECG leads placed on the patient. The BP, skin temperature, physical appearance, perceived exertion, and symptoms include chest pain, dyspnea, dizziness, leg cramping, and fatigue are also checked during the test. Test is terminated when the target heart rate is achieved or if the patient has already signs of MI. Next. Our nursing responsibilities or intervention. We need to instruct the patient to fast for at least 3 hours prior to the test and to avoid stimulants such as caffeine or tobacco. So advise the patient to fast. Of course, they're going to run on a treadmill. You do not want to do an exercise when your stomach is full. So you need to tell the patient this, to fast for at least 3 hours before the test and avoid certain stimulants that can further stimulate the heart, such as caffeine and tobacco. And the doctor will also instruct the patient not to take cardiac medications such as beta blockers before the test. And clothes and sneakers, such as rubber-soled shoes, suitable for exercise should be worn by the patient. Of course, the patient is not going to run barefoot on the treadmill. They need most specifically rubber-soled shoes for it. Maybe exercise clothes can also be applicable. The nurse must also explain the procedure to the patient. So we need to tell them what the patient is going to do on the treadmill or on the stationary bicycle. And after the procedure is done, we need to monitor the patient for 10 to 15 minutes for any of the following, because it probably can lead later on to MI if the patient's heart is unstable. So we need to monitor them 10 to 15 minutes after the procedure. For the pharmacologic stress testing, this is recommended for patients who are cognitively impaired, especially for patients who are having a hard time following instructions, and those who are unable to follow directions as well, or those who are physically disabled. So let's say, for example, the patient is an amputee. He has an amputated leg, for example. So how is he going to do the cardiac stress testing or the exercise stress testing? What is done instead is the doctor is going to administer drugs such as vasodilating agents like dipyridamole, quercetin, adenosine or adenocard, or regadenoson or lexiscan. This is given as an IV infusion, and they are used to mimic, so it will imitate the effects of exercise by maximally dilating the normal coronary arteries. So they are vasodilating agents. And the side effects of these agents are chest pain, headache, flushing, so you expect the patient to appear red. There's also nausea, heart block, and apnea. So we need to inform the patient about the side effects as well. If necessary, the effects of the drugs can be reversed with IV aminophylline. So if the patient has any of these things, such as apnea, heart block, it can be reversed with IV aminophylline. Dobutamine is another option since this is a sympathomimetic. When we talk about sympathomimetic drugs, these are drugs that can imitate the sympathetic nervous system stimulation, wherein most of the vital signs are increased. So sometimes this is given, dobutamine. What are our nursing responsibilities here? The patient is instructed not to eat or drink 3 hours prior to the test, similar to the exercise stress test. The patient is also instructed to refrain from eating any liquids or foods that can contain chocolate or caffeine for 24 hours prior to the test, since caffeine is a stimulant. And if caffeine is taken in by the patient, the test should be scheduled. And patients taking aminophylline, theophylline, or dipyridamole are instructed to stop taking the medication for 24 to 48 hours prior to the test. So they will temporarily stop taking the medication, just in case the patient also has asthma or COPD. They can stop these medications for the meantime. Next, we have Transthoracic Echocardiography. It's a non-invasive ultrasound test that is used to measure the ejection fraction and examine the size, shape, and motion of cardiac structures. And this one is useful in diagnosing in the pericardial effusions, which we will discuss further on in this subject, determining chamber sizes as well, and the etiology of heart murmurs, such as evaluating the functionality of the heart valves, including prosthetic heart valves if the patient has undergone a surgery wherein they have implanted a prosthetic heart valve, and evaluating ventricular wall motion as well. So here in the transthoracic echocardiography, This is also known as 2D echo here in the Philippines. What they are doing here is they use ultrasound, the ultrasound, in order to visualize the heart, most especially the chambers, that only the chambers can be visualized here. Even the sizes of the coronary arteries are also seen through echocardiography. Now, before the patient will have this procedure, one of our nursing interventions is to explain to the patient how this is done. And usually this takes around 30 to 45 minutes. And we'll advise the patient that a gel will be used on the chest in order to move the transducer onto the surface of the skin. Because in order for that transducer of the ultrasound to slide on the patient's skin, gel will be used. A lubricant is going to be used on the patient's chest. And most especially if the patient is a female, since this is done over the chest of the patient, we need to provide privacy for the patient. So it's a closed curtain procedure. So make sure that the drapes or the curtains are closed, and in order to provide privacy to the patient. Same goes as well when we are going to apply the ECG electrodes on the patient's chest wall. If the patient is also a female, we are going to make sure to provide privacy for that patient, since the female's breasts are going to be exposed in these procedures. Next, we go to cardiac catheterization. It is a common invasive procedure that is used to diagnose structural and functional diseases of the heart and great vessels. And this involves the insertion of a percutaneous insertion of radiopaque catheters into a large vein or an artery. Once this is done, fluoroscopy is used to guide the advancement of the catheter to the right or left side of the heart, referred to as right and left heart catheterization. So you can see here in this example, what they are doing here is they are injecting a radiopaque dye in order to visualize the blood vessels of the heart. So we start out with right heart catheterization first. It usually precedes left heart catheterization. This is used to assess the function of the right ventricle and the tricuspid and pulmonary valves. The procedure involves the passage of a catheter from an antecubital or femoral vein. Take note, since the right side of the heart carries unoxygenated blood, the doctor is also going to insert the catheter, from the antecubital or femoral veins. So veins are going to be involved here. Take note, when we're talking about the right side of the heart, veins are going to be used. For the left side of the heart, arteries are going to be used. But let's start first with the right side. So antecubital or femoral veins are used into the right atrium, right ventricle, pulmonary artery, and pulmonary arterioles. And pressures and oxygen saturation from each of the areas mentioned are obtained and recorded to determine pulmonary hypertension, if there are any. A biopsy is also going to be done if necessary. They are going to obtain a small piece of myocardial tissue in order to detect for the presence of any cardiomyopathies. So take note, in right heart catheterization, veins are used for the insertion of the catheter. So this is how it is done. As you can see here in this example, a vein is used in order to insert a catheter to check for the right structures of the heart. Now we go to the left heart catheterization. Prior to this procedure, patients who have previously experienced reaction to contrast agent are premedicated with antihistamines such as diphenhydramine, Benadryl, and corticosteroids such as prednisone. Remember, one of our nursing responsibilities before this procedure is going to be done on the patient is to ask the patient if they have allergies to seafood. Since seafood is high in iodine, the radiopaque dye that is going to be used in cardiac catheterization is iodine based. So some patients can have an allergic reaction to that radiopaque dye. Now, in order to avoid that from happening, they will be premedicated or pre-medicated with antihistamines or even corticosteroids. So the left heart catheterization is performed to evaluate the aortic arch, so to check for the size of that, the major branches as well, the patency of the coronary arteries, and the function of the left ventricle and the mitral and aortic valves. So it's more about the visualization of the left side of, or the structures of the left side of the heart. So the cardiologist inserts the catheter into the right brachial artery. So the brachial artery can be used, or a femoral artery, and advances it into the aorta and right ventricle. Take note, the patient will be injected with a local anesthesia, depending on the site where the doctor is going to perform the cardiac catheterization. Angiography is performed in this procedure as well as coronary angiography. So take note, the dye here is used in order to visualize the blood vessels through angiography. Angio means pertaining to the blood vessels, graphy, visualization. So that is what angiography is all about. So as you can see here, the femoral artery is used in order to insert the catheter. The doctor is going to administer a local anesthetic first on the patient's thigh before inserting the catheter. So our nursing interventions before cardiac catheterization is to instruct the patient again to fast 8 to 12 hours prior to the procedure. So tell the patient not to take in food before the procedure. Inform the patient that this procedure can be done at the OPD or the outpatient department. Inform that the patient will feel sensations during cardiac catheterization such as palpitations and flushed feeling throughout the body when the doctor is already going to inject the contrast agent, that radiopaque dye. Now, before the procedure is done, encourage the patient to express any fears or anxiety, to relieve the patient from it, and assess seafood allergies before the procedure so that we know when to give antihistamines. Nursing interventions after cardiac catheterization. We are going to observe the catheter access site for bleeding or hematoma formation and assessing the peripheral pulse in the affected extremity. The blood pressure is also checked as well. Heart rate is going to be checked every 15 minutes for an hour, every 30 minutes for an hour, or hourly for 4 hours or until discharge. So that is very, very important to check for the blood pressure, heart rate, and heart rate. Even the peripheral pulses are checked. Evaluating the color or the temperature, color, and capillary refill of the affected extremity during the same time intervals should also be done by us nurses. Screening carefully for dysrhythmias by observing the cardiac monitor or by assessing the apical and peripheral pulses for changes in rate and rhythm. So if you are a trained nurse who knows how to read the ECG patterns, you can be trained for that as well if you are going to be assigned later on, or if you're going to be working later on at the Philippine Heart Center at Quezon City. You will be able to read ECG. And after the procedure is done, advise the patient to have bed rest for 2 to 6 hours. Instruct patient for any or to report any chest pain or bleeding or any sudden discomfort from the insertion site. So the patient experiences any of these. And monitoring the patient for contrast-induced nephropathy by checking creatinine levels. So they need to have their creatinine levels, the BUN, checked as well, because sometimes the contrast agent can cause nephropathy on the patient. So the doctor, after the procedure, is going to instruct the laboratory to obtain samples from the patient to check for their creatinine and BUN. So that's it for the diagnostic evaluation of the heart. If you have any questions about today's lecture, please do not hesitate to message me on Facebook Messenger. I can answer you any time of the day. So don't be shy to ask any questions about our lecture, and I would be more than glad to answer them for you. Again, thank you for attending today's lecture. And our next topic would be about infections of the heart. Thank you.